Hello, I'm Greg Stock, CEO of Thibodaux Regional Health System. It's a pleasure today to have Dr. Paul Monier with us. Dr. Monier is a physician and an infectious disease expert, and we're going to talk for a moment or two about some aspects of coronavirus care. We think there's maybe a little bit of confusion about the screening and the testing that's going on. And Dr. Monier, you want to talk about that for a moment or two, maybe help clarify that for people?
Sure. So testing is actually sending a nasopharyngeal swab to test for active infection with the virus. This is opposed to the screening protocols that we've put into place, mostly to screen visitors to the hospital. Screening is basically a short questionnaire and usually a temperature check to make sure that those people coming into our system aren't carrying the infection. Again, the testing comes into where we're looking for actual infection.
So those screening, the bullet points for screening, the key aspects of it, would you mind reviewing that?
Those are going to be basically symptoms, fever, and then mostly respiratory symptoms, shortness of breath, cough, sore throat, and those types of symptoms that are commonly encountered with different types of viral upper respiratory infections, and certainly with this infection, combined with a risk assessment based on where they've been, who they've been around. Have they been to high-risk areas, and have they had any known contacts with a patient who has COVID-19 or coronavirus?
Thank you. So, we want to say that we're doing screenings at Thibodaux Regional Medical Center, and we're asking people before they enter the premises, so those questions, including things like you said, where have you been recently? And that's a very important matter, serious matter as a matter of fact. And it's there to protect our staff and our patients both. And, it's a little bit of an inconvenience, but one that's well worth the effort. And so you see at Thibodaux Regional now, effective last Friday, that you enter through essentially one entrance. You're screened before you go in. Patients have one visitor with them at a time, and those visitors are also screened. The same in our wellness center and anywhere where we do business on the hospital campus. Any comments on that, Dr. Monier?
No, that's it. That's exactly right. We're putting these measures in to try to make it as safe an environment as possible for, like I said, both our patients and our staff.
Thank you. Thank you for being with us today.